Hello, good afternoon. Dr. Trude Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our Saturday Open Clinic with Dr. Trude. Today's clinic is a very important and special clinic, especially to pregnant women in the community. So if you're currently pregnant, be it first trimester, second trimester, or third trimester, we want to talk about the top complications that might occur in this particular pregnancy, especially if you're a Black pregnant woman. Unfortunately, for some reasons, when you become pregnant, there is a kind of a divide in the outcome of pregnancy between Blacks and whites, if you're living in a population that have Blacks and white in the same place. So that will be the basis for our communication today. So please, when you join, introduce yourself, tell us where you're located. Then as soon as possible, I'm going to start my presentation. After my presentation, you will have opportunity to ask your questions. After the YouTube presentation, I will also have another presentation in Facebook. So if you're not in our YouTube, if today is the first day attending, thank you so much. Make sure you subscribe, make sure you like, and also share the channel so that other people can benefit. But today is a very good day. We're talking about complications in pregnancy. So please quickly join so we get the clinic started. Okay, so once I have an indication that people have joined, I will start the clinic. And remember, the clinic is in two phases. The first part is my presentation. Then the second part is an opportunity to ask your questions. So thank you so much and welcome to today's clinic. And feel at home. Let's see who is attending. Introduce yourself and let's get the clinic started. Hold on, let me check in with my admin to make sure everybody is aware the clinic has started. Just give me 1 minute. Okay, so I think one of the admin just joined and I'm gonna wait for one more person to join, so I will start. Today we're talking about complications, top complications in pregnancy, especially Black pregnant women. We are gonna make that case of the reason why you should be more aware of this so you can go and start your ANC on time. And I'm actually going to start. Once you come in, join me. We're talking about complications that can occur in pregnancy. Now, comparatively, in countries that have Blacks and whites in their population, for some reasons, Black women are 2 to 3 times more likely to die. We're talking about death in pregnancy, pregnancy-related death. So all the complications we're going to talk about today, there are actually 10 complications, but we are going to focus on 5 today. The next time I'm going to talk about the remaining 5 for want of time. Now, for some reasons, when we had a comparative analysis of Black pregnant women and white pregnant women, we noticed that Black pregnant women are 2 to 3 times more likely to die from these complications. This particular study was actually backed up by CDC, Center for Disease Control in America. Now, you may begin to wonder why. Why should a Black pregnant woman have that high risk of dying from pregnancy and a white lady might likely not have the same complications? The reason is very simple. You see, in our society, we have different classes, different financial barrier. People might have access to healthcare. People might have access to insurance. So the biggest player that leads to death in the Black pregnant women population is actually the socioeconomic standard. So white women are more in place to get insurance. They are more financially stable. Now, even when we remove the finances and social class, we still discover that Black women, for some reason, have higher possibility of dying in their pregnancy. And this is concerning. So this is what we're going to address today. And predominantly, our group is filled with Black women. So I'm not here to discriminate. We love our women, white, black, it doesn't matter. But we want to know why. Why do we have this big gap between what happens in the white population and what happens in the black population? But we're going to talk about the complications, okay? Now, pregnancy will last for an average of 42 weeks. That's the maximum your pregnancy is supposed to last. Once your pregnancy has reached 42 weeks, by any means possible, we have to terminate that pregnancy and bring out the baby, and you will be also happy to see your baby. Now, within these 42 weeks, there are a couple of complications that can happen. Now, some complications can happen in first trimester. Some can happen in second trimester. Some can happen in third trimester. Now, some other complications might be unique to only one particular time, and some can happen anytime. Number one of this complication is what we call gestational diabetes. Gestational diabetes is one of the most common pregnancy complications that affects about 6 to 9% of virtually all pregnant women globally. 6 to 9%. Now, if you don't know about this, you might not know what to do. And for some reason, we also have a predisposition of Black pregnant women having more possibility of having complications from gestational diabetes. We're going to get to the reason why more Black pregnant women might likely be predisposed to having this. Now, if you have proper monitoring and proper care, so where do you start this care as a pregnant woman? By registering for your ANC immediately. So with careful monitoring and proper care, we can manage gestational diabetes without compromising your baby. But if it's not managed, you and your baby's life might be in danger. Now, what are the risk factors? For some reason, no one knows exactly the causative effect of gestational diabetes, but we know some risk factors. Is a bit of an enigma in terms of understanding the whole pathway of gestational diabetes. But we know that some specific factors might increase your risk of developing gestational diabetes, especially among Black people. We want to stop that bleeding. There are some factors unique to pregnant Black women which might predispose them to having gestational diabetes more compared to pregnant white women. Number one, if you are overweight or if your BMI is above 30 in this current pregnancy you're having, that's a risk factor of developing gestational diabetes. If you have a family history of type 2 diabetes, so if your mom had type 2 diabetes or your dad had type 2 diabetes or your uncle or your auntie, that's a family history there. Now, if you had gestational diabetes in your previous pregnancy, that's a risk factor. If you were pre-diabetic, so pre-diabetic means you are dangling between being a proper diabetic or not being. You're just in the middle because your blood sugar level is high, your body is not handling sugar properly. So if you are pre-diabetic before you became pregnant, that's also a risk factor. If you have excessive weight gain in this index pregnancy, that on its own is also a risk factor. So these are the factors that might likely make a Black woman to be predisposed to having gestational diabetes, which can complicate her pregnancy. If we don't diagnose gestational diabetes, one of the presentations is that when the baby is going to be born, the baby will be very big. So women that have gestational diabetes will have babies we call macrosomic babies, very big babies. And we need to plan ahead on time. We need to control your blood sugar. We need to make sure that your baby's brain and everything is properly developed. That's number one complication in pregnancy. For some reason, it's more commoner in Black women compared to white women. Now, the second complication is what we call preeclampsia. Preeclampsia is hypertensive complication in pregnancy. Preeclampsia is the possibility of having a couple of symptoms which will happen about the same time after 20 weeks. So anytime you hear about preeclampsia, I want you to put 20 weeks in your mind. Now, there is another criteria we also apply to 20 weeks, miscarriage and stillbirth. If you have unintended loss of your pregnancy before 20 weeks, it's called abortion or miscarriage. If it happens beyond 20 weeks, it's called stillbirth. Now, in preeclampsia, if you have sudden increase in your blood pressure, if you have sudden generalized severe swelling in your body, especially your hands and your face, Now, if we run your urine sample, every pregnant woman will be subjected to going for urine examination. So if we notice that your blood pressure is very high suddenly, and we notice that you have generalized body swelling, especially in your face and in your hands, then we check your urine. We notice you have protein in your urine. Until proven otherwise, you have preeclampsia in that pregnancy. Now, if preeclampsia is not treated properly, it can lead to a lot of complications, including death to the mother and the baby. Now, what are the risk factors? What are those things that if you likely have them, it will likely predispose you to having preeclampsia? Now, if you have pre-existing condition, which is commoner among Black women, things like history of hypertension. So if you are already a hypertensive woman before you became pregnant, the possibility you might have preeclampsia is high. If you have obesity, now how do you know you have obesity? When you plug your body weight and your height, your BMI is giving you from 30 above, you have obesity. So obesity is a risk factor. If you have sickle cell disease, if you are diabetic, if you lack vitamin D, or if you have some autoimmune disease like lupus, then these are the factors that might likely predispose you to having preeclampsia. Preeclampsia is a complication that can suddenly end your pregnancy, and you might end up losing your life, and your baby might not be even around. So given that Black women have higher rates of hypertension, higher rates of sickle cell disease, higher rates of obesity, higher rates of diabetes, Black community will have a higher predisposition of having preeclampsia complication in pregnancy. So can you see the pattern? There are certain things that happen to Black people, and when it happens to them, it affects the totality of their life. Preeclampsia is top on the list. Another complication that can happen in your pregnancy, especially to Black women, is what we call preterm labor or preterm baby. Now, any baby that didn't get to 37 weeks before the baby is born, that baby is classified as premature baby or preemie. Now, preemie simply means your baby didn't get to term. Term is 37 weeks. So what does term mean? Term means when your baby gets to 37 weeks, pretty much all the important organs in your baby have been fully formed. So if your baby is delivered today, we're going to check you and your baby will send you guys home. Now, we discovered that for some reason, preterm labor, which will lead to preterm birth, affects about 1 in every 10 infants in US. Think about that for a moment. For every 10 deliveries, 1 in them was born before 37 weeks, according to CDC. We need to put this into bigger perspective. Now, unfortunately, the rate of preterm birth among Black women is 14%, almost 50% higher. In white is 9%. In Black is 14%. Look at the gap. The question is why? So there are so many Black expectant mothers who should, by default, know the risk factors of having preterm baby. When you know risk factors and you avoid risk factors, you prevent that particular thing from happening. So what are the risk factors for likely having a preterm baby? Number one, this is very, very important, carefully. Chronic emotional stress. Chronic emotional stress. So if you don't have support system, if your partner is abusive, if you are not happy, if no one is helping you, if your work is stressful, if your environment is stressful, if you don't have enough resources to sustain your pregnancy, they will lead to a lot of emotional stress. So for some reason, when you're not in a happy relationship, the possibility your baby will come early is very high. If you're a smoker, whether you're primarily smoking or you're hanging around people that smoke, smoking is a risk factor. If you do the recreational drugs, that means you do all those street drugs you're not supposed to use, you can also predispose yourself to your baby coming early. If you drink any form of alcohol in your pregnancy, if you have abnormalities in your cervix, in your womb, if you got pregnant before 17 or you got pregnant beyond 35, this is a major risk factor of having your baby early. If you previously had your baby in the past before 37 weeks, that's a risk factor. If you are not spacing your pregnancies at least by 18 months, that's a risk factor. If you have some teeth and gum disease, which most people don't like going to the dentist until they have a very, very bad toothache, then they go and remove it. If you don't form the habit of going for routine dental health checkup, you might likely have some periodontal disease that might predispose you to having preterm birth. If you are a preterm baby yourself, you also have a risk factor. If you have some uterine and vaginal infection, especially two types, bacterial vaginosis and trichomoniasis, these will lead to likelihood of having your baby early. If you have untreated urinary tract infections, if you are carrying more than one baby, these are complications. These are conditions that might likely lead you to having your baby early. I hope I'm making sense. So if we know this, we can begin to mitigate. We can begin to plug in here and there things we can correct so that the baby can at least get to 37 weeks. Now, in the event that your baby probably didn't get to 37 weeks, it's still okay. There is a special place for such babies. They are called neonatal intensive care unit. Your baby will be sent to that particular place. Your baby will be stabilized before you go home. Another complication in pregnancy, which is also commoner among Black women, is what we call HELP syndrome. HELP syndrome is not the type of help you're thinking about. It's HELLP. This is also a complication. Now, if you have preeclampsia, I've already mentioned the symptoms of likelihood of having preeclampsia. If preeclampsia is not attended to, you can actually develop eclampsia. So HELP syndrome is more of a complication between an untreated preeclampsia, untreated eclampsia that will now degenerate to more severe syndrome. So it's a condition that typically happens in conjunction with preeclampsia during the third trimester. It will be very unfortunate to carry your baby up to the point of delivery, then something will begin to happen to your baby. HELP predominantly is a condition that will affect the liver, the way your liver performs its role, and the way the blood clotting factor in your body functions. This is very rare, but if this happens in pregnancy, very, very debilitating, and if care is not taken, can affect the life of the woman. So while we don't know exactly what leads to HELP syndrome, we know that about 70 to 80% of women who got diagnosed of HELP syndrome had preeclampsia. So preeclampsia is a big player in things that can lead to this condition. Now, unfortunately, Black women have higher risk of being diagnosed of HELP syndrome because of the fact that they have also increased risk factor of developing preeclampsia and eclampsia. So it's important, my people. Now, how can you protect yourself from HELP? Remember, we don't know exactly what causes HELP, but we know some predisposing factors. So the biggest player in preventing and protecting yourself from complications from HELP is to know the symptoms. So how can HELP syndrome present? Headache that will not go away. Severe debilitating headache that won't even allow you to sleep. That might be a sign you might have this. Sudden excessive weight gain. Suddenly you're adding a lot of body weight in this pregnancy. Excessive and consistent generalized swelling of your face. Your body is retaining a lot of water. You look yourself up in the mirror, you can no longer recognize the woman there. That might be a symptom of HELP. Sudden pain and tenderness in the upper side of your belly. Sudden increase in vomiting, sudden increase in seeing double, blood vision, sudden increase in having nosebleeds, generalized feeling of not just being well, and some women will also have seizures. These are likelihood you might have HELP syndrome. You must be very, very careful. If you notice any of the things I mentioned, please ring your doctor immediately and begin to go to the hospital, because a stitch in time saves nine. Now, when a woman is pregnant, we are not just thinking about the baby, we are also thinking about the woman. Because guess what? If for some reason, God forbid, you lose your baby, you are gonna live to have another baby, right? But if something happens to the woman, she will not be around to have another chance. So unfortunately, when we are presented with a choice between a baby and a mother, if the baby is going to put the mother in danger, if the woman is going to die, we'll save the woman first. I'm keeping it real. This is medical fact. So we want to make sure that that woman is properly taken care of, so she will be around to have another opportunity to have a rainbow baby. Rainbow babies are babies you will have when you have previously had a loss in your pregnancy. So many women are going to have rainbow babies. So the last point I'm going to make, there are so many complications, but the 5 complications I've mentioned are the commoner one. The last one is heart diseases. For some reason, there are several conditions that affect the way your heart functions, including what we call coronary artery, arrhythmia, and congenital heart defects. There are some women that are born with arrhythmia. There are some women that have congenital heart defect. Their heart was not properly formed or got some disorder, and we didn't know. Then you became pregnant. And suddenly you begin to predispose yourself to having heart disease. Now we're going to talk about the risk factors. What are the risk factors a woman that is pregnant might likely have to the point of developing heart disease? High blood pressure, high cholesterol, smoking, diabetes, unhealthy diet, lack of exercise, excessive alcohol use. Have you noticed a pattern? Do we have this common among Black women? Yes. Black women have possibility of having more high blood pressure, more high cholesterol, more possibility of being exposed to smoking, more diabetes, unhealthy diet, lack of exercise, and alcohol use. It can also happen to white women, but predominantly because of our socioeconomic status, more Black women might not have the education to know that when you're pregnant, you're not supposed to smoke, you're not supposed to drink. So whatever you do every day can affect the outcome in your pregnancy. So these are the risk factors. Now, what are those conditions predominantly seen among Black women? I've already mentioned that. Hypertension, obesity, diabetes. These factors will increase the rates of developing heart disease. So anywhere you see hypertension, for some reason, they love obesity. Anywhere you see obesity, for some reason, they love hypertension, they love diabetes. So they work hand in hand. Matter of fact, in medical practice, they are called the syndrome X. Very deadly combo. You do not want to develop the three of them. So these are factors that if it happens in a woman, the possibility of this woman having complications of heart disease is very high. And heart disease is #1 killer of women in America, if not every other place. So if we know about the risk factors and you talk to your doctor, we begin to keep an eye on symptoms that might likely tell us you might likely have heart disease. So what are those symptoms? Sudden extreme swelling. So if you notice, there's a kind of a consistency between the 5 complications. They present the same. Sudden generalized body swelling, weight gain, extreme fatigue, fainting, persistent cough, chest pain, shortness of breath. If you have any of these conditions in your pregnancy, please ring your doctor. It's possible you might likely be predisposed to pregnancy complication. Please, my people, my sister, especially Black pregnant women, our aim is to have your baby in your hands. A pink, crying, wailing baby. We don't want a blue baby. We don't want a baby that will not cry when he or she comes out. We want you to have your babies. If you can focus on the 5 complications, heart diseases, HELLP syndrome, gestational diabetes. If you can focus on HELLP, if you can focus on heart disease, if you can focus on gestational diabetes, if you can focus on preterm labor, if you can focus on preeclampsia, these are the top complications you might likely have in your pregnancy. It doesn't matter if it's first trimester, it doesn't matter if it's second trimester, it doesn't matter if it's third trimester. Please modify your life to suit preventing this from happening, because once you develop these conditions, unfortunately, time will come when we have a choice to make. Either we allow your baby to go or we save your life. And most times, 99.999%, we save the woman, and unfortunately, the baby might not make it. The clinic is going to open now. Please start asking your questions. Start asking your questions. I can see Sada. I can see Chi from Paraka. Then I can see Tosin, amazing lady from New Jersey. The clinic is open now. Please start asking your questions. Immediately after this clinic, I'm going to give exactly this clinic in our Facebook page. So transition to Facebook immediately from here when I'm done with this, because we have a predominantly bigger community in Facebook. Okay, so what are the questions? What causes protein in urine during pregnancy? Now, like I told you, ordinarily, you're not supposed to have protein in your urine. So when we have signs of protein in your urine, any trace protein, 3 Cs, 1 plus, 2 Cs, it might likely be an indication you have preeclampsia. So one of the presentations of preeclampsia is increase in your blood pressure, generalized body swelling, especially in your face and in your hands. Then when we check your urine, we see protein in your urine. That's a sign you might likely have preeclampsia. So preeclampsia is a big player. Now, protein in your urine might also be a reason from the fact that you have likelihood of having kidney failure. If your kidneys are functioning properly, the stuff that come out from your urine will not lose protein. So when we have protein in your urine, it means that your body is leaking protein, which is a sign that certain things are going down the drain. So top on the list of things that might likely present with protein in urine is what? Preeclampsia and kidney disorder. Okay? Can preeclampsia cause birth defect? No. Birth defect is an independent factor. So birth defect means when the two parents were coming together to make the baby, likelihood that probably one of the chromosomes didn't transform properly. So remember, the mother will bring 23, the father will bring 23 to have 46 sets of chromosomes. So birth defect simply means things that happened to that baby as the baby was forming. So preeclampsia is an independent factor on its own. Preeclampsia will not and do not cause birth defects. Birth defects can happen independent of anything. Now, there are a couple of lifestyle that might predispose you to having some birth defects. If you smoke, if you drink alcohol, if you have a lot of stress, if you're not taking your prenatal multivitamins, your baby can develop some congenital birth defects. But if you live healthy, if you don't have any chronic medical condition, or if it's properly controlled, then you have possibility of having a healthy baby. So guess what? A healthy mother before pregnancy, within pregnancy, will likely have a direct proportional outcome of having a healthy baby. An unhealthy woman, a woman that had diabetes, a woman that had hypertension, a woman that had obesity might likely complicate the pregnancy and the baby might be sick. A woman that was smoking before pregnancy continued to smoke in pregnancy. A woman that was drinking alcohol before pregnancy and now in pregnancy will likely transfer the alcohol syndrome to the baby. So there are some babies that will be born, they have what we call fetal alcohol syndrome. Their head will be tiny. They will have a lot of brain damages simply because of the way the mother lived before she became pregnant and the way she's currently living in her pregnancy. This is why it's important to register for your ANC. And if you notice the numbers of people in this clinic is very, very little because people feel, oh, once I'm pregnant, then I'm good. That's not true. If you're pregnant, please register for ANC on time. Okay? Please keep asking your questions. I have 3 more minutes. You have an appointment to remove fibroid this September. Wish to know why you're placed on birth control pills. So here's the deal. Sometimes we want to control your cycle. Sometimes we want to place it on quiescent mode. So quiescent mode means no growth zone. Just stay like that. So if you have symptomatic big fibroid and they gave you a date for your myomectomy and they placed you on birth control, do you know why they're doing it? Because that fibroid is already significantly going to affect the outcome of any pregnancy. So no good doctor will allow a humongous fibroid inside the womb where your baby will be developing. So the reason why they're giving you birth control pills is to make sure you're not pregnant prior to that surgery. Very simple. Now, anytime your doctor prescribes any drugs for you, in order to understand the role of the drug, ask. So the question you're asking me, you could have asked your doctor. But what I'm telling you right now is this. For them to give you an appointment for myomectomy, it means that fibroid is significantly affecting your fertility. So possibly it's inside your womb, it's either intramural, it's either submucosal, and it's either bigger than 6 cm, and they need to remove it. Now, if they don't place you on birth control, you will likely become pregnant. And when you become pregnant, once you become pregnant in fibroid, there is nothing anybody can do for you until you deliver the baby. Now, you do not want to have big fibroid and you're pregnant. That fibroid is going to give you a lot of hell in that pregnancy. So avoid having big fibroid and becoming pregnant at the same time. Both of them will be competing for the same thing that will be helping your baby to develop properly. Okay? Please ask your questions. I have 2 more minutes. 2 more minutes, then we transition to our Facebook and we continue the conversation there. Please remember to like this channel, share this channel, subscribe, set your notification every Tuesdays, 6:30 p.m. US time, 11:30 p.m. Nigerian time, weekends, 12 p.m. Eastern time, 5 p.m. Nigerian time, and you see me talking about things I love talking about. I love women. I love babies. So anytime you show up in this clinic, we'll find a topic of great interest, a topic that will help our women to become pregnant, a topic that will help the pregnancy to be okay, a topic that will give us the opportunity of having our babies in our hands. So please, if you have any other question, ask before I go. Okay? All right. So one more minute. Okay, I think I have another question. Can pregnancy-induced heart diseases go away after pregnancy? Well, it depends on the likely reason. So remember, if we control all those risk factors, hypertension, diabetes, high cholesterol, lack of exercise, smoking, alcohol. So if you remove all those risk factors, we can manageably see what we can do. But there are certain things that once we have it, it's there. Now, there are some conditions that when you have it during pregnancy, once pregnancy is done, you come back to normal. Preeclampsia is number one. Gestational diabetes is number two. So there are some women that will become hypertensive. It's called pregnancy-induced hypertension. Once your pregnancy is done, your blood pressure will come back to normal. Now, some women can also have gestational diabetes. It means that when you became pregnant, you develop diabetes. When you deliver your baby, your your blood sugar comes back to normal. But for half, once anything is compromised in the heart, it doesn't go away easily. So it's something you need to continuously follow up with a cardiologist. We keep an eye on you. You improve your lifestyle. You stay on some medications, and hopefully you have a good opportunity. Okay. Can a mother transfer a heart disease to her baby? Well, if you have genetic familial heart disease condition, the answer is 100%. Let me tell you this. It will shock you. If your father had hypertension, had diabetes, had what we call cardiomyopathy. So cardiomyopathy is a syndrome that affects the heart. If your daddy had sudden heart attack, sudden death, or what we call, early death, there are some people that their dads died in their 40s. If you are not careful, you will develop 100% of everything your daddy developed. And also depending on your lifestyle. So there are certain things you're born with. They are in you. So depending on your lifestyle, you can prevent yourself from developing it. So the answer is yes. If you have familiar history of diabetes, if you have familiar history of hypertension, if you have familiar history of cancer, if you have familiar history of heart disease, yes, it can be transferred to the generation next. And if care is not taken, it can also happen to you. So if your daddy died very early in the 40s and nobody did autopsy to tell us exactly what happened, and if it's related to heart condition, hypertension, diabetes, the possibility you also face the same type of death is very high. So the answer is yes. Be very, very, very careful. Extremely careful. Okay, so thank you so much. Can we please begin to transition to our Facebook? We're going to spend about 30 minutes to talk about this topic, and we're going to have fun. Now, remember, we have 8 days. 8 days to the Super Masterclass on the 28th of this month, 9 p.m. Nigerian time. You do not want to miss this event. This event will catapult you from infertility to motherhood. I'm telling you what I know. We have 3 panel of doctors. You don't want to miss this event for anything. So registration is currently ongoing. Make sure you register. Now, if you have been placed in a place of joy, authority, and so much treasures, consider sponsoring some women to that event. It will be amazing. Slot is still open. Deadline is going to be on Saturday. Make sure you register today. And I'll see you guys shortly in Facebook. Begin to transition to Facebook now. And I'll see you in our page. Thank you for coming. Enjoy the rest of your evening. Bye-bye for now.